Okay, so we have a patient that is pregnant and she was asking me for some stretches and exercises to help with the stress of as the baby grows, new pains, all that types of stuff. We have a lot of patients that we see and help through it, so I'm shooting this for her and the rest of them and any of y'all that aren't even patients that need help. So as the baby grows, like I said, it pulls the body in different ways. We want to do certain things to counteract some of that input. One thing that will always help is just going into a deep squat. So I'm going to have Sarah actually take shoulder width, a little bit wider, and then drop all the way down into her squat and just get comfortable sitting there. An extra thing that she can throw in is if she puts her elbow on the inside of her knee and just works that knee outward. You can kind of roll left and right, just working on opening up the groin on both sides as you can. Work on keeping the chest up so you don't let your posture get too slack and cause irritation in the lower back from it. But just sitting in the bottom of the squat is always going to be a good thing and help relieve some tension through the groin and the lower back. The next thing is wobble chairs we use here for all of our pregnant patients. So if you're a patient and you've been pregnant during your time with us, you would know we always have you come back and use this after the adjustment. You don't have one at home, so you can always use a wobble disc. I think we sell these for like 20 bucks or something, I'm not sure. But the goal with this is to keep your upper body stable and just roll left and right, front and back. You can eventually work full circles, even figure eights. Typically we're working on pumping the discs to get fluid to go back in. For people that are pregnant, you're just working on maintaining good pelvic mobility. So whenever the time comes, the pelvic can open up and baby can come out. Fun stuff, right? Then after that, there's a stretch that you can do. A lot of people know of the piriformis stretch, but it's very difficult as the baby grows and gets in the way. You can't really lay on your back and pull your knee to your shoulder. But if you have a chair or anything you can put your leg on, you would just lay your leg across it and try and cross around it. So belly would be here, and I'm just going to drop down. Ideally, I would have something blocking my knee here, and as I come down, I can really get a good pull into the piriformis and out into the glute through there. Next thing would be if I'll have Sarah lie on her back here. We already worked on pelvic mobility, but now I want her to actually work on pulling her belly button in and flattening her lower back on the ground. So first, a lot of times I'll have people arch upwards so you know what it feels like. There you go. And now go the opposite direction, press down, try and hold. As the stomach is coming out, the abdominal muscles are going to be inhibited, so anything you can do just to work on pulling backwards is going to be good. It's also good for pelvic mobility, but working on dropping, pressing down, and holding. After that, you can let this leg drop. If I'm going to work on the next muscle of somebody in the office, it's the psoas. The way we do that is we come inside of the pelvic bone and actually work along. It's just a really deep muscle, so it's hard to strip out yourself. But you can do a stretch that will help it. And let's say that if I was going to work on her left side, but it's me, I'm going to go through a stretch. What I would do is set into a lunge, turn towards that side, drop my pelvis towards my foot, and then lean back. So whenever I go through that, I can get a little bit of a stretch on that psoas. It's not quite as effective, but it'll help. I would mainly go through that series just to keep it simple. So we have the wobble, we have the abdomen pressing downwards, the psoas. The last thing that I would hit is actually the round ligament, which can get really tight. And if you were to imagine an imaginary line running from the belly button to the pelvis down here, like that, you're going to feel across, feeling for where there's like a tight nodule. You can try both sides. As soon as I find something that's tender and tight, I'm just going to go in and give pressure and hold until it eases up. It could be 30 seconds, a minute, minute and a half, or even 2. It's just something that gets really tight because it attaches to the uterus. And as the baby grows, if, let's say, the sacrum is offset, that sac can be torqued and those ligaments get really tight. So, of course, we would want to check and adjust, but for the time being, you can still try to get those ligaments to let go to help. Try those. Let me know if you have any other questions. Caitlin, have a good day.